Hey, everybody. Welcome back to another episode of Interpreting in Healthcare, a podcast brought to you by the National Council on Interpreting in Healthcare. Today, we have a very special guest. We always have special guests, but I'm very excited to have today's guest with us because it is where our worlds overlap in language access. Our guest today is Ana Soler, who is the co-chair of the National Association of Educational Translators and Interpreters of Spoken Languages and founder of SeSo, a source of qualified and trained interpreters in education. Ana completed her degree in social work at Georgia State University and obtained her master's degree in public health from Emory University, also known as the Harvard of the South. She is close to obtaining her PhD in special education at the University of Georgia. For over a decade, Ana has worked with the largest school district in Georgia as the Language Services and Parent Outreach Coordinator, developing, implementing, and evaluating professional development opportunities for multilingual personnel, as well as discovering opportunities to engage multilingual families in their child's education. She's authored interpreter training curricula nationally, including the Intercultural Parent and Youth Leadership Program, the Interpretation Academy for Bilingual High School Students, the Arkansas Interpreter in Education Credential Training, and a 40-hour course for medical interpreters. She's been an adjunct instructor at the University of Georgia for 13 years, teaching 3 online courses she authored, including the Professional Interpreter in Education Certificate course, the Professional Interpreter in Special Education Certificate course, and the Professional Translator in Education Certificate course. As part of her doctoral studies, Ana and a team of subject matter experts have developed a research-based national certification test for spoken language interpreters in education. Wow, that's a heavy lift. Thank you so much for joining us today. Welcome, Ana.
Absolutely. Thank you so much for having me. It's always great to see you.
As I mentioned earlier before we started recording the podcast, I am always so excited to strengthen alliances with similarly minded organizations. Yours in education, ours in healthcare, but both very client centered in terms of getting that person what they need to understand where they are. And in the schools and in pediatric hospitals, that's a place where the triad is not just 3 people. It's a
Right.
child and parents, which may be an extended family, and the language access needs in that mix that I think it's really nice for our 2 organizations to be able to see what we have in common as well as the areas where we differ. So in addition to all the training and the certificate programs, the fact that you came up with a code of ethics is something that really sparks my interest because National Council is also updating their code of ethics. So
Yes.
before we get too far into the weeds, I'm going to ask you to look back where you're standing now, look over your shoulder and look back. What is it that really stands out, or what was a moment that was pivotal for you in terms of embracing such a big role? You have a lot of coursework, you have a lot of training, you have the professional organization that you co-chair. Like, how do you get all of that in one day? And what's in the past that got you to this point? What
Oh
sticks?
my goodness, what a beautiful question. I think one of the things that I'm always grateful for is to wake up every day just loving what I do. I think the passion started just by being a non-English speaker. When I came to the United States, I was 14 and I spoke absolutely no English. There was, absolutely nobody to help my family, nobody to guide us. except family members. And it just, feeling that that sense of frustration, feeling that sense of just helplessness, trying to figure out, how to navigate a new system. It just really drove me to do something about it. I started as a medical interpreter, working for a children's hospital here in the state of Georgia, and that, I was the interpreter by default just because I was bilingual. And my main job was actually as a social worker, but because I was bilingual, they pretty much assumed, well, she must know some medical terminology. So let's just put her in the ER and see what happens, right? So I think looking back, Eliana, a lot of the things, I always think that things happen for a reason. And every single step that I've taken in my career has led me to this. Every single person that I've met, and whether it's a positive energy or not as positive energy, has led me to what I do today. So all of those experiences as a social worker, as a bilingual person, just not really knowing the terminology, but being thrown in those situations without any training, all of that just started to boil in me. And I just really needed to do something with that energy and with that passion. And I was very lucky to find other people who were just as passionate. So I think, one of the things that makes me the most proud is that NAETISL is a real family, that we feel so very much connected with each other, with our members, with our board members, with the people that we encounter in our courses that are just as passionate as we are. And so it just makes it easy. I'm not going to lie and say, my days are wonderful every day. Absolutely not. But just seeing the big picture is what really keeps me going. And seeing the impact that we're making every single day with every step that we take is what really matters to me. So I don't know if that answered the question, but but it's really about, finding that passion, finding what you love to do, and then finding a community that supports you with it is really beautiful. And I'm very lucky to be living that life.
I feel really lucky too to just be in a room with people that get it, whether that room is
Yes.
virtual or physically present. But talk about trial by fire, because I'm sure as soon as they identified you as bilingual staff, then everybody sent everything
Of
your way.
course, of course.
Can't
No code of
imagine.
ethics, no training, no guidelines, no best practices. It was just, here you go. This is a person that needs you right now, and help us train others. After a while, I was the one training others without really receiving any training myself. And then, when I moved from that setting, from the healthcare setting to education, it was the same idea. I had no training. I had some experience as a medical interpreter, which really helped me. But at the same time, it was a whole different field, a whole different environment. And so I felt very unprepared, and really lost. And so out of all of that frustration came the idea of creating trainings eventually for my staff in the school district where I was, and really, again, creating an organization that can provide the guidance that I didn't have as an interpreter. So it was really that.
I see that reflected on your website, and I have to
Yes.
plug your website
Thank
for
you.
folks looking for educational material, training materials. It
Yes.
is so well done, and
Thank
there
you.
is such a variety of topics. It makes me proud of your organization.
Thank you.
Just looking through it all, going, oh, I am so jealous. When I started out, there was like nothing like this. We
Nothing.
had to cobble together our own standards of
Yes.
practice as we worked together. And, HR at the time was people that only spoke English and didn't
Right.
understand much about what was different about translation and interpreting, or would give us a list of staff that maybe spoke in a heritage way another
Hmm.
language, and say that's who you call if somebody comes in for a language that isn't covered by the three of you staff interpreters.
Right.
And I remember we took it upon ourselves to go through that list and stop by and interview everybody and ask them, even though it's self-assessment, which is not
Hmm.
reliable, to
Right.
say, do you speak this really well, or do you speak it only like to ask for your favorite foods from your grandma or somewhere in between? And
Yeah.
sometimes people said, I speak it really well, but I don't want to interpret about things to do with people's diseases or their
Yeah.
body parts. Like, it just
Sure.
freaks me out. Nobody had asked them. They had just gotten put on that list. So
Right.
thankfully, we have moved away from doing that. I still see places where people are told to bring their family member in. So
Hmm.
that is something we need to continue pushing
Yes, and I
against.
think that's the key. That I think this type of work or this type of passion, needs to continue, because there's a lot of work to be done. We are very lucky in the educational field that we have people like you and other leaders in the healthcare field who have paved the way for us. The judicial interpreters, sign language interpreters, healthcare interpreters, you have really created so many, pillars that we were, in the education field or NAETISL specifically, we were able to look at that and say, okay, this is what's working for them. Let's figure out how to adapt it to our setting, because it is a little bit unique. There are many, many overlaps between healthcare and legal interpreting and education interpreting, but it is very unique in some ways as well. But we were very lucky that all of you had already done so much work that it was a relief that we didn't have to start from zero. But I cannot imagine what it was like for people who really started the whole idea of having certified interpreters in healthcare. It must have been just an amazing task, and they did it. So, but there's a lot more to be done. That's for sure.
Yes, because in the words of Vanessa Costa, that I share this opinion. I do not want to be part of the generation that was the first to be able to obtain a national credential and
Yes.
also the last generation of human being interpreter.
Right.
So
Yes.
we need to partner with those people that are currently working on developing AI
For sure.
code and programs and apps to offer insight into
Hmm.
how it should work rather than the rush to put something out that cannot handle nuance and
Hmm.
would therefore be dangerous in any situation that requires nuance, which
Yes.
is in court and in the hospital and in the
Hmm.
schools for like an IEP or special education.
Absolutely.
So right now I see AI as being a huge help for those repetitive things like
Hmm.
wayfinding
Right.
or explaining menus or where the parking building is and how to
Hmm.
prepay before you get on the elevator or
Right.
carry something around like they give at museums that
Hmm.
tells you where to go for your next appointment once it has been loaded in, or
Right.
so much feedback forms, translation of forms, things that can be vetted and that lack nuance, that are
Hmm.
very straightforward. We are ready to do that now.
Yeah.
And
Absolutely.
and interpreters have never had enough time in their day where they could go sit in a patient's room and explain, what a club sandwich was to
Hmm.
somebody from a culture that doesn't eat sandwiches. But
Right.
AI could do that now. AI
Hmm.
can help us with closed captioning and
Exactly.
with note taking,
Hmm.
or explaining medicine names, right? You hear it, but spelling is not my strength in English.
Right.
Isn't it nice to be able to look up what that was and how it works when you know how it's spelled? That was always my challenge looking up new words in English, but you need to know how to spell it
How to
before you
spell
can
it.
find it in the dictionary.
I agree. And I think it's an advantage to look at it that way, to look at AI is there, it's going to be developed, it's going to be, the visibility of AI is just going to be exploding even more. So it's a matter of us trying to figure out how to work with it and how to educate those who are using it right now to make sure that they use it correctly. And we
What
have
is
that
safe
in the
now
schools.
and what
Yes.
is dangerous, and how do
Yes.
we improve? How do we get there rather
Hmm.
than the rush to say, oh, it can do everything? I see
Right.
ads for agencies that say they have automated translation and automated interpretation that's AI driven
Right.
so that their costs will go down, the quickness
Hmm.
and the accessibility 24/7. But how about accuracy?
Right. Well, it doesn't help that we have a executive order that specify that that's the goal, right? That basically AI is the thing to use to replace or to reduce cost. So I think it's a matter of us in the field to help educators in our case, for example, and of course in the healthcare field and legal settings to educate them on what situations are appropriate for AI and what is not. We also must emphasize the cultural piece. Sometimes we forget that. We focus so much on the language transference, between one word and another, but there's so many cultural layers that we have to be careful with that I don't know that any AI right now is really aware of, or they're really thinking about this. Um, a lot of our families who are in the special education setting, there's specific words that may mean something completely different that may become offensive to somebody else and may, you know, uh, prevent the person from being really engaged in the education of their children, for example. And so we just have to be very vocal, and whenever we have the opportunity to have those teachable moments with educators, with clients, to help them understand that it is a tool just like everything else, but it is a tool that needs to be taught how to use correctly. So
Yeah. So looking at the current landscape, is that what jumps out to you as the most pressing issue? Or for me, I think coexisting with that is, given the political winds, will there be
mhm,
less active oversight of the laws that still remain? Like, will
right.
people be allowed to slack off compliance? And, where does that end? Is it just language access? Will we be able to
Mhm,
breach HIPAA because nobody's looking to enforce the rules anymore? That
mhm.
that worries me. What's on your mind for risk?
Um, so, the attacks on language access are definitely concerning. I think one of the things that I keep thinking about is that everything is cyclical, everything is a phase. And so this will end at some point. And I think right now is when we need to come together as organizations. And so I was really happy when I got your invitation because of that. Because we do need to remain as united as one voice so that when all of this is over, because at some point it will be, at least that's my hope. That's what keeps me going. Then we'll be ready as organizations to really continue this challenge of really defending language access. There's a lot of focus on assimilation instead of acculturation, and really less of this highlight of the importance of multilingualism, less of the, kind of diminishing the importance of being multicultural, multilingual. And that worries me too, especially in our young generation. And so those are the areas where we as an organization, and me personally, we are focusing on making sure that the young generation understands that this is cyclical, and they're going to be the ones that are going to be carrying that torch for us when we're not here. And so, yes, there are many things going on right now in terms of, that disrespect, I think, for language access and for who we are as a country. But this will be over at some point, and we need to remain as united and as together as we can possibly be. So, yes.
Agreed. Agreed. Strengthen those bonds and don't be afraid to reach out and form new ones because
Yes.
that kind of unity is difficult to overcome. And most people who live in this country enjoy most of the freedoms that we currently have and
Hmm.
don't feel the need to change them all that much. And one of those is to be free of discrimination due to country of origin.
Hmm.
And like I said earlier when we were speaking before the podcast began, I may not be able to affect what happens in the Oval Office. I certainly can't, but I can participate in my local community.
Yes.
I can show up at my local town hall. I can go to the school board meetings. I
Hmm.
can go to the library and community events and ask for services. And my community, at my local level, I have not seen any pulling back from wanting
Hmm.
to support uh, people whose first language is not English,
Right.
children to participate in services that are available at parks or libraries or events in the
Hmm.
community, farmers markets, you name it. I see language access everywhere I turn in my neighborhood.
Good.
So the fact that people can experience it and have a positive experience is exactly the type of waves we want to make. Not
Yes.
not negative, aggressive, angry waves, positive, like, look, see how nice it is when it all
Hmm.
works.
Right.
And that's how you get support, I think, at the local level for people to be voted in to do the right thing.
For sure. And I think one of the things that we have also thought about, or that we have been doing for a while, is also work with the end user, meaning for our organization to work with parents and to work with families to help them find the tools, the voice, so they can do that self advocacy. Because we as interpreters, we're not there to advocate for anybody, perhaps ourselves sometimes, but really our families are the ones that really need to have the tools to be able to self advocate and to ask for an interpreter if there's if one is not provided, if somebody comes in with a young person, asking them to interpret, teaching the families to understand why that's not ethical, why that's not appropriate, really helping them understand the logistics of that, and really, helping them really have those tools to advocate for themselves. Because a lot of things do happen when the clients speak up, right? And when the clients say, no, this is not right for me. And those are NAETISL specifically has always been great about working with everybody at the table, not just the interpreters, not just the translators, but also the educators, the school leaders, and also the multilingual families that do collaborate with interpreters, and perhaps they don't need an interpreter right now, but they have felt the need at some point. And so that is really important. That's really what has made us, stronger as an organization, to really listen to all of those perspectives at the same time. Because we all want the same thing. We all want to be understood. We all want to be heard. Educators have specific goals. They want the families to be engaged, to collaborate, but they may not have the right tools to be able to do that. And the families want to collaborate. We have many families who want to come to school and want to attend all events. They want to be at every parent-teacher conference, but they're not able to do so for a variety of reasons. And the interpreters want to do a good job. So we really are, very proud of that we are able to really listen to all of those perspectives and try to figure out how to help them all, which is not an easy task for sure.
And having access to interpreters means that engagement is there.
Yes.
The desired engagement that maybe the school or the hospital may misperceive as, oh, they are not showing up for the appointment or for the meeting with the teacher. Well, that's because they can't communicate.
Right.
Once they know that language access is available, my experience is hospital based, but I remember people from both coasts, both in
Hmm.
New England and here in the Pacific Northwest, they will drive 2, 3 hours to go to this clinic because they know they can get an interpreter there.
Yes.
And that just shows that the desire to be able to be heard and
Hmm.
understood both ways is there. People will participate in your programs if you allow them the dignity of being able to understand what's happening to them and their family and being able to ask for what they need
Hmm.
without being made to feel less than. It really, really makes
Absolutely.
a difference. So, looking ahead, what do you wish for? It's
Oh
wide
my
open.
goodness. What do I wish? I think more cohesiveness in communities of interpreters and translators. I know we have very specialties. We have these branches, but I think we all understand that language access is important. I think we all understand that it actually is not just the language access piece, but it's having good quality language access, because language access can mean having something translated by Google and we check the box of providing language access. But I think we all understand that that's not good enough, right? And
No.
that our clients deserve a lot more, whether they're families, whether they're, patients, it doesn't matter. Our clients deserve more, and our educators, our physicians, our healthcare providers, they deserve more, and they deserve to have somebody who is qualified. So I think looking ahead, I really want the organizations to create those bridges, and we've tried to do that with sign language interpreters, with legal interpreters, of course, with healthcare interpreters, because in education, one of the things that fascinates me the most about the education setting is that it combines all of those fields. We see in special education a lot of legal terminology, definitely a lot of medical terminology that I was grateful to learn first before I started working in the school. That's why I mentioned that everything, in my life has happened for a reason at the specific time when it needed to happen. But, all of these overlap, all of those, fields do overlap. And so we do need to figure out how to collaborate a little bit more, and how to, create one voice, one unit, so that we can be better advocates for not only ourselves as professionals, but also for the field itself. So, but I also want to see more work with youth, and we're lucky we received a grant recently to create a program for young interpreters, not to interpret themselves, but to actually give them the tools to become advocates for language access. And that's what I love about it, that we're going to be teaching the young professionals that we're recruiting how to become language access ambassadors, how to understand language access rights, how to understand what a code of ethics is, how to understand when a qualified and a trained and certified interpreter is needed, how to ask for those services for their families. And so we really are creating a new generation of advocates. And I'm so excited about this project because it is something, very close and dear to my heart. But we get to work with interpreters who are, or young bilingual students who are already interpreting for their families, but they'll be able to have this, more formalized training to really become those advocates for language access. So I'm really excited about that.
Oh, that sounds fascinating and
Yes.
very close to an idea that I have tried to pitch unsuccessfully to different high schools to have a 2 year sort of vocational training program
Yes.
that would give students 125 hours worth of preparation for healthcare interpreting. And then once
Mm-hmm.
they turned 18, some of which would happen during their senior year and others the summer after they graduated, or
Mm-hmm.
through the rest of the year, they could sit for the national exam with
Yes.
lots of practice and lots of hopefully assimilated knowledge
Yeah.
over the course of those 2 years and hit the ground running with a national certification.
Hmm.
had yet to have anyone bite on that. And the idea of learning to be a language access advocate, that's fascinating to me. There should be a whole academy of options for heritage language speakers because
Yes,
they are the unicorn, so to speak. They
exactly.
have perfect pronunciation in at least two, if not more, languages, and a good
Hmm.
understanding of the cultures that those languages come
Yeah,
from, and just make a wonderful ambassador if they are so inclined. Oh, I wish you so
absolutely.
much success,
Oh, it's I
and you were
can't wait
able to
to
get
get
some
started.
funding. That's
Yes,
wonderful. I am
we actually
clapping
got to.
all by
Thank you,
myself.
thank you. I'm absolutely excited about this. It's collaboration between NAETISL, the University of Georgia, and Georgia State University. And what we're trying to do is make sure that we recruit youth from what they call displaced communities. So there will be some Spanish speakers, but what we're actually looking are for children who may have come here as refugees, as children, and now they have been interpreting all of their lives for so many different settings, but really giving them that opportunity to look at interpreting as a career, supporting them with language specific help, which is something that we really do well. That we kind of pair somebody with somebody else who can be a mentor in their language, so that they can have that language specific practice. And exactly what you said, give them that path of certification, whether it's for legal, for medical, for whatever they decide to do, so that they can see this as a career path. So we're, really excited to get started. We're hoping to be able to recruit the 20 participants that we need very soon. We're going to actually pay them to take the course. So it's the perfect package. So I'm excited to get
Oh,
started.
that's wonderful. And
Yes.
it's feeds my inner hope that
Yes.
the ripples will keep expanding outwards,
Yes.
irrespective of what one monolith may or may not say.
Thank you. See, Eliana, you get me. That is exactly why I said to this project, yes, I'm sure there's 24 hours in the day. How am I going to get this done? But just having that hope and working with the kids is really what fills me up, because that's where we need to focus our energy, and help them be feel supported in the middle of all this. At some point it'll be over and they need to have that support. So
Well, that is just the most encouraging thing I've heard this week.
I'm
And
so glad.
building a better future for language access with
Yes.
the people that will be carrying that banner going forward. The young people of now are the
Yes.
future leaders in language access if you give them the tools. Thank you so much for being part of our podcast today,
Absolutely.
Anna. This was awesome. Thank you for sharing your ideas and your successes so that others feel empowered to chase those ideas and those dreams and get started making their own little ripples
Yes.
locally. Because once you put all of us together, it's a tidal wave, and that's what I hope for our combined future together, as allied professional organizations and as
Yes.
just individuals working to promote better understanding through language access. Thank you so much
Yes. Thank
for
you,
joining us
Eliana,
today.
for it's always an honor to collaborate with you, but thank you for allowing me to share our story, for sure.
And we'll see you soon, folks. Ciao, ciao.